welcome everyone to THETA Rounds today. I'm super excited. We have Uwe Siebert here with us, and Uwe's old, not old, long-term colleague and friend, but so he's a professor of public health, medical decision-making, and health technology assessment, and the chair of the Department of Public Health, Health Services, and HTA at the University of Health Sciences and Technology in Austria. He also has an appointment at Harvard as an adjunct professor in epidemiology, health policy, and management. And he describes himself as a passionate causal thinker. So I'm really, really excited about the talk today. I also say, Uwe, I always reflect back. Uwe is one of the key people responsible for me being in Canada. So if any complaints, there you go. I think might have been 21 years ago when we met in Italy at was I think the second SMDM meeting in Europe. So it's quite exciting going really way back. So anyhow, we had a quick discussion before. So as usual, if you have any questions that is more kind of quick and for clarification, then ask them during your talk. If you have, we will have time for discussion at the end. So the bigger questions, maybe save them for the end. There is a Q&A section, so you can type them or you can raise your hand and then we will manage the question. And without further ado, I may hand it over to Uwe. So thanks so much and take it away.
Thank you very much. Thanks and welcome everybody. Are you hearing me well? Okay.
Yes.
Yeah, I'm a physician by training, but very early fell in love with my other half of the heart, which is logic and maths and computer science, epidemiology. So this is what we talk about today. It's my huge pleasure to be invited, and thank you, Beate, for the nice introductory words. I also want to thank Ida, who was really very professional, way supportive in preparing all this. So welcome everybody. One of the most important tasks of what we have to do as researchers in health and life sciences, and you got this on the announcement on the poster, is that we support decision makers by providing causal interpretations from data, basically from real world data. And in this talk, in this webinar, I would like to introduce you to the principles of causation, but mainly focusing on what we call causal diagrams or causal graphs. And we will look into something which is called directed acyclic graphs and how this is used in different ways and also very formally to make decisions on how we should analyze data. And for many of you, these data may not just be the end result, but the data may be going to be a part of a decision model, an input parameter of a model, or it can be a standalone epidemiological analysis. There are even some of the methods I will explain have also a place in adjustment within randomized controlled trials where you usually think there is no confounding. I will probably not talk about that part unless there is still time left at the end. So I will have a fast pace, so fasten your seatbelts. And if really there is something urgent to understand, interrupt me. I will also have some interactive parts where we decide something together. And hopefully you can break the ice and help me with that. So on this slide, you have all my my positions, and I'm happy to share the slides or some sheets with you afterwards. So what and this is a bit self-promotion, what I'm going to give you here is a snippet of our health technology assessment and decision science continuing education program. There's a full 5-day course on causal inference, and what I'm presenting is part of the first day here. There is also a newsletter you can subscribe. I will also send you the readings. There are 2 key papers related to this talk. One is by Greenland, Pearl, and Robbins. You may know their names. Jamie Robbins, one of the inventors of causal inference, was my thesis advisor. So I started giving talks like this actually in 2001, where everybody thought this is still, mystery. Today, this is basically what you must do. And there was a recent paper from one of my doctoral students, which also caught some attention, how you can have bias if you don't do the right statistical epidemiological causal analysis. And to do that, we need these causal diagrams. There are also books and readings, a SAS book, but also Miguel Hernan, Jamie Robbins wrote the book about causal inference, the What If book. There are also other readings, especially one of my doctoral fellow, causal evidence in health decision making. So how do you join what we talk about today with decision modeling? And this is a case example paper I will address in the end. So these slides that you see here in pink with a star in the headline, these are the ones I skipped there for your background, for your reference, if you want to look something afterwards. In this talk, I will talk about first the 4 ingredients, just 2 minutes of causal modeling. And we will take one of these ingredients, which are causal diagrams. It's basically about finding what variable is a confounder and choosing the statistical method. Also talking about something we call identifiability. Can we actually estimate the causal parameter of interest, like the effect of a treatment, or people even talk about the effect of an exposure like body mass index? Can we do that, or are we missing some data, and therefore we know we will not get the causal answer? I have prepared 2 case examples. I will probably show you one, if there is time, another one, and then we have hopefully a bit time for Q&A at the end. So the ingredients, the 4 ingredients of causal decision modeling, when I talk about decision analytic modeling, is that we first have to start with a causal research question that must be well defined. It basically must be an intervention. It's difficult to talk about an exposure that you cannot change, but maybe changeable exposures. The second step is set up your causal diagram. That's what we will do together today. And then you have to develop a causal model. Usually we think our decision models are causal anyway, but there are also criteria when they are not. We will not cover that today. And then there is causal inference methods. Can we use regression or other statistical methods to derive our adjusted causal parameters for the model or for the effect? Or do we need something which is called G methods when regression analysis fails? And how does that relate to machine learning? And there's also the concept of target trial emulation. We will also not talk about that. So we will focus on today's topic of causal diagrams. First one, definition slide. We differentiate between point actions and time varying actions. So point action is something you do once, a one-time surgery, one dose immunization, whereas time varying actions are treatments, interventions that go on over time. You may have a second or multiple dose immunization or medical treatment you take every day or you take every morning, and that's a time varying action. And then we have something that we call dynamic actions. These are if-then rules. In decision analysis, we call them strategies. You know, I take the drug until I get a side effect and then I stop. Or I do not take statins until my Framingham risk score reaches a level of 15% and then I start. So you don't know when the individual will start, but you give the individual a real rule, and we call that a dynamic action. That's the language of causal inference. So let's go into causal diagrams. First of all, causal diagrams have been around. The first time, actually, 1921, Sewell Wright, a biologist, has used them, and then they were forgotten. And they came back 1999 when I was sitting in Boston and reading that paper, which changed my life. That's causal diagrams. Now, that was 1999. You can do the calculation how long it took to have a talk like this with you, which is still relevant. And many people I talk to, even epidemiologists, they know these exist, but they are not really fully yet integrated in our teaching. So I had a nice spotlight interview with Judea Pearl, who is the inventor of the causal diagrams. He's a sort of a genius type person, won all the important awards. One of them is the Turing Award, which is basically what they call the Nobel Prize for Computer Science. And we both, you have the link here, you can read the stories. We both look back nearly 30 years, for me it's more 25, and reflect that it really takes 20 years until a good idea comes up and not just reaches, the top scientists, but reaches the mass, reaches, the physicians that write the top papers in JAMA and New England Journal of Medicine and so on. And that is today. That is today, a quarter century later. So there are some anecdotes you may want to look into that. Now, turning to the causal graphs, what we would like to do with a causal graph is following this idea. We think that nature is, like a machine, like a a set of laws, of rules that generates data. So nature does something and has laws and things change. And some of them we see, and we call them data. And so the data are basically the footprints of nature. We don't see full nature, but we see some of the traces, footprints it leaves. And a causal graph represents the process, how these data are generated. So it's a picture of arrows and variables where we put down all the known and unknown, the known and unknown variables. So we can even do that before we have measured, before we have done our study, to think which variable influences what. Now you may say, well, that's what I would like to find out, but no, there is a causal assumption that you have to make in the beginning, like, Popper's theory in philosophies, you can only change assumptions with data and observations, but you have to start with something in a Bayesian sense. And this is what we're doing. We start with something that we call a directed acyclic graph, a DAG. So in this DAG, what you see here, the DAG is a specific causal diagram. Now, this diagram is a diagram. You can see that. Later we will talk when it is causal. The diagram consists of letters representing variables and links representing association. A link is a line without an arrowhead. So that means statistically associated. But in this graph, you see that we don't have simple lines. All the lines have an arrowhead, so we have a full graph of arrows. Arrows represent causal relationship. A line between A and B means A and B are somehow statistically correlated. The arrow from A to B means that A causes B. And that's the reason for the correlation, for example. But you can also see, even if there were no arrow between B and C would be correlated through the confounder A, through another variable that influences both. So the arrows represent causal relationship. And now we have another language, which we call path. Let me ask you, for example, which paths I can have starting in B and going to C. A path has always a beginning and an end. So from B to C, we have two paths. We have this one along a line, and we have that one along a line. You note when I talk about paths, I don't worry about the direction of the arrows. I can go against the one-way street here. So I just have a path. So there are two paths from B to C. That's what we call a path. Then we call this whole diagram directed when all the links are arrows. In this graph, this is the case. So this is a directed graph. We call the graph acyclic when there are no loops. So for example, if you would go with an arrow from A to B and then back from B to A, then there would be a loop. Or if you would go from A to B to C and then back to A, that would be a larger loop. We don't have such loops here. Therefore, my graph here is acyclic, no loops. So what you see here is formally a directed acyclic graph. That has no meaning yet for causality unless we make a last claim. And we would like to call this graph a causal graph, a causal diagram, a causal DAG. I can only claim calling this a causal DAG when I make the assumption that there are no other variables that influence two of these or more at the same time. Of course, A has some parent. A has been produced by something. So there may be another variable influencing A. There may be another influence variable for C and another one influencing B. But as long as these are not connected and these are not influencing two at the same time, I can drop them. So I can leave some parents out unless they have sort of two descendants, two children here in this graph. In this case, I would say, okay, we assume there's some knowledge is behind these variables, all have meanings. And then I call this a causal DAG. Now that's a huge assumption, right? So you have to really start with this. Now the assumptions in such a DAG are going further. They are not so much embedded in the arrows, because you could say, I don't know, maybe B has a protective effect on C, or maybe a slightly harmful, or maybe just a tiny one. So an arrow just means you don't really know. It can be big positive, big negative, or tiny nearly zero. So you put an arrow if you don't know. The real assumption is that there is no arrow between D and C, for example. So the arrow is left out, and there is no direct arrow from A to D or vice versa. So this basically means this is your assumption. It's like in a regression model, if you do backward selection, and then some of the variables have a p-value of 0.2, and they have an effect estimate, a hazard ratio or something, but then you say it's not statistically significant, you drop them. When you're doing this, you're restricting nature. You're making it simpler. You're basically saying the effect is 0. When you drop a variable from a regression analysis, that means you say the connection is 0. And that's probably not true, but so that's a very strong assumption. It's different than I couldn't prove that there is a result. So the assumption is in the missing arrow. That's what people who start with these DAGs have usually more problems understanding that part. But that is what we want. When we say we model something, we want to get a grip on nature, we have to reduce the complexity. We have to remove some of all these possibilities that may be there. And that's by removing errors. So that means modeling, reduction, simplification, and that's what we have to do in science. So a lot of the things I said here, they're more general and they apply to other things we do in science. Let me continue with the language here. So I said there are two paths going from B to C. So this one goes forward, right? If you are living in B, that's your house, then this is the front door. You look out of the front door, you see the tail of the arrow, and the arrow goes into the future, influencing C. So we call that a forward path. And then the opposite is the path from B via A to C. We call that a backdoor path. So you look back, basically look at me in the video. So the front door path goes that way, but from the back, in my back door, in my back, basically, I'm hit by an arrow, and that is then called a backdoor path. Note again that it doesn't matter how I call this path, what's happening here and which direction this is going. This may seem like more forward, but the name of a path, whether it's backdoor, front door, is decided in the garden of the house here. You don't even have to look at the rest. Something is going, outside here, so that's a front door path, and that remains a front door path for the rest. And this path is going backdoor, so it will remain backdoor in the language or in terminology for the rest of the path, no matter where the next arrow goes. Then the last thing we use, and I have done that already, is kinship terminology. So A is a parent of B and C. You could call A grandparent of D, but we don't use the grand language, grandparents and grandchildren. So we say basically A has 2 children, B and C, and A has 3 descendants, B and C, but also including D, further descendants than children. Similarly, B has 1 parent, which is A. D has 1 parent, which is B, but D has also another ancestor, which is A. C has 2 parents, but no further ancestors. So this is what we use. How do we use that in the real world? So we had done a study, and this is the case study. I gave you the paper just published by Feli Kühne, one of my doctoral students working on causal inference. And we were looking at LOT2, which means line of treatment to second-line treatment in ovarian cancer for the outcome survival. So we knew this is our intervention. We can now not call this just ABC, but we could call this X or A-like action or T-like treatment. So here LOT2, second-line treatment. And that's survival. That's my outcome, my O, my Y, or however you call the dependent variable. And the question is whether there's an error. Because I don't know that, that's what I want to investigate, I put it. Because I would remove it, I can stop doing my research. I would say I claim there is no association, then I wouldn't have to look at the data. So this is the start of my directed acyclic graph. And then we add with experts all the other variables. And this takes, a few days sitting with experts what they think from, their guesstimates or from literature or from other studies, even randomized trials, but also observational studies. In our case, some of these variables were missing. So note a DAG, to make it causal, must include the non-measured variable. And then you see it's a pity that nobody measured that, but that's the fact. Then these were the available variables. And then we also said some of these available variables have low quality, but you don't have to do that. But you have to show somehow which variables are measured and which variables are unmeasured. That's very important. because you can use to do something with the green variables, but you cannot do that with the red variables because you don't have them. So we will come further down, we will come to what you want to do with these green variables. So these are other examples which I just picked from the internet, how people represent the simple DAGs, more complicated DAGs with colors and so on. There's also software called DAGity, where you can basically ask the software to do the drawing, but you would still have to say, where are the arrows? So my first quiz to you is, are these diagrams DAGs? And I'm asking first the question, is diagram A, is that a DAG? Question, yes or no. So I don't know whether you have a way of answering this. You may just put it in the chat and say yes or no, and then I can see that. I'm actually looking at the chat right now. So who thinks this is a DAG? Just put in a yes, and who doesn't think, put in a no. So I see one yes here. Okay, so I take that one person. Oh, now I get more. Okay, yes, this is a DAG. It's directed, they're all arrows, and there is no loop. We're not talking about whether it's causal because you don't know the meanings of these variables. In the further graphics, I will always take the action, the treatment, the intervention, call it A, and the outcome Y, and the rest of the variables some other letters. Now, okay, this is a DAG. How about the second one? Who thinks this is a DAG? Just put in your yes, no. Okay, I already see a lot of no's. So people have probably found that here is a link. There is no arrow, so this is not a directed graph. This is still a graph. It may be causal or not, but something is missing here. It's not a directed one. How about the third one? Just put in again your answers. Okay, everybody says no. You have very fastly seen that there is a loop, A, Y, L3, L2, A. So that's a loop. So this is a directed graph, but not an acyclic one. It's a cyclic graph. So this is simple, starting with the language. Now, we haven't talked about the meaning of all these things, just, the technique, the tools, and the technology. So the next piece I'm talking about, and I keep that very short because probably no, is the difference between statistical and causal relations. Still being, 25 years in the business of biostatistics and epidemiology, I learned a lot from the language of computer science. So in a statistic relation, we would say A is related to B, associated, correlated. You could even put mathematical terms, the multiplication sentence of two independent events and stuff like that. But I like very much, and I use that in teaching, to express it in the computer science language. That means if I don't know about A before, I can have a probability of B happening, like my baseline risk or something. But if somebody tells me A, age, maybe something, or it can be a cause, it can also be a consequence of B, whatever. If somebody tells me something about an associate variable, if I learn that variable A, then I know more about B, or the probability of B. That's a way of interpreting association. It has no direction. It doesn't say something about causality. It doesn't even tell me what was there before. And that's different with causal relation. In a causal relation, we say A causes B, and that means if I change A, then B will change. That's not happening in all associations. So the associations are the entire world, and the causal relations are part of them, where the arrow goes into one specific direction. So here we say information and probability flows between A and B. There's no direction. And here we say causal effect flows from A to B. That has a direction. But that's just, intuitive language. There's nothing proven mathematics behind that. So this is my little contribution to the didactical field. I just call these three little simple DAGs. I called them the three atomic DAG molecules. So when I'm interested in the simplest case, where I have a third variable, which may be intermediate step confounder or whatever, when I have my interest is the effect of A on Y, then the third variable L can be before A, it can be between A and Y, so in the middle, also in the time flow in the middle, or it can be in the future of both A and Y. So that's basically the three ones we have. Now, how do we call those? We call this one in causal diagram language, we call this a causal chain. This is a causal fork because L is, look at my video, L is sort of forking into A and Y. And we call L or this configuration, an inverted fork, because A and Y are pointing towards L. The direction is different from the causal fork. Now we have other, in epidemiology and health sciences, we have other names for that. We call this the intermediate step, the mediator between A and Y. So if A is a cholesterol-lowering drug, then L would be cholesterol and Y would maybe heart attack. So A causes L and L causes Y. So we would say A causes Y indirectly through the intermediate step. The causal fork is something what we know as a confounder, third variable that influences both A and Y, and we call that a confounder. So before we go to the confounder, I would ask you something to answer intuitively. Sorry, I showed the solution. If you have this configuration, and I will only give you A and Y. Let's say, A is using statins or not, and Y is having a heart attack or not. And I tell you there is no confounder because this is the true DAG. There is nothing else confounding. There's just a direct effect, maybe in a trial where there's no confounding. And I would give you a 2x2 table, a 2x2 table, only A and Y. You don't get the data on L from me. And you try to find out whether A and Y are associated, not causally, just associated. In other words, if I learn about A, do I know more about Y? What would be your answer? And probably it would be yes. They are associated because, the statins reduce the risk of heart attack. You don't need to stratify for L or something like that. So when we have this configuration, we say probability flows through L. So we just learned that probability flows is mediated through an intermediate step. Look at my video again. If I am L, it looks like this, right? Or it looks like that. So this one is an intermediate flow variable. Probability flows directly through my head through L. This one is a causal fork. Now I'm asking you, in this DAG, I'm telling you A has no effect on Y. The null hypothesis is true. Treatment A does not change survival Y. But I have a confounder here, influencing both of them. What would you think if I do a crude analysis between A and Y? Would they be correlated? The answer is yes, we know that. That's called confounding. It's a biased, it's an association. Some people say spurious association, a biased one. It's actually not spurious. The association is there. If I learn about A, I know more about Y. Because if I learn about A, high-dose chemotherapy, I know, oh, poor boy, the person must have had a very severe disease, L, and probably dies soon, Y. But it's not because of the chemotherapy, it's because of the disease that was the reason for everything. So yes, probability flows through a confounder. You can prove these things with a mathematical proof called d-separation, but we now rely on our intuition. And the last one is a collider. That's a bit more complicated, and that's the little animal. The collider that makes this field so important and probably also so difficult. Who of you would think, and put that in the chat, that probability flows here? So A and Y, although the null hypothesis is true, like in the confounder part, who thinks that A and Y would be associated in the 2x2 table? Who thinks yes, who thinks no? Okay, I get yet some no's here and one yes question mark, one yes. That's nice. Look, you were all probably right in the first two, but here something strange is happening. Intuitively, it looks like they are connected, but to be honest, they are not. So the right answer is no probability flows through a collider. Why not? Imagine A and Y are two dice. You roll them, 1, 2, 3, 4, 5, 6, and then you count the sum. The sum would be L. Just because you generate the sum doesn't make A and Y statistically associated, right? If I look at A, I don't learn anything about Y because the other A doesn't tell me something about the other die. Or in kinship language, if me and my wife, if we just generate a child, the fact the child may be associated with, with eye color or whatever you think, but we are still not looking similar. If somebody looks at me, they don't know how my wife looks and vice versa. So this is why the collider doesn't. The collider is actually on this pipe here. When you think this is water flowing, probability flowing, this is like a valve that is blocked. It doesn't let the flow go through. So this is something we can prove, but believe me, these three statements are correct. Now, these were unconditional associations we were talking about. When we now do conditional associations, and I wouldn't need more time to pick on your intuition, a fantastic thing happens. The status of the valve changes. So with all these things, we will see that when I control for cholesterol, then all of a sudden A and Y are no more associated. That makes sense. If I control for the confounder, I remove the confounding, so A and Y are no more associated. But interestingly, if I control for the collider, then all of a sudden I let probability flow. And you can think of several examples and maybe come up yourself with one why that is happening. It basically says, if I stratify for my children, basically looking at each one of them individually, and there is something very remarkable which is inherited from one of the parents, and then I learn about father doesn't have that property, I know mother must have it, right? So something like that says me, if I learn about A, then I know more about Y. If the effect that I'm seeing is not explained, that's a rare symptom in a patient. If there are two diseases that can generate the symptom, if I look at one X-ray and don't find the disease, I know it must come from the other disease. So if I learn A is not present, I know Y is present. So this is what we call the explaining effect in medicine. And for us, it is important when we control for a collider in my data set, I would generate association and maybe mistake it for a causal effect, but there is nothing there. So we learned there are cases where you should not control for a variable. And we were explaining this with the valves and flow of information. So going back to this slide, now we talk about bias. If you control for an intermediate step, you remove some indirect causal flow. We call that controlling for mediator bias. You should not control for a variable that lies on the front door path. You don't control for the future of your intervention. Confounding lies in the past. It's basically what you see here is an open backdoor path. So you must control. If you don't control, then you call this confounding bias. And here, if you control for a collider, that's the worst thing you can do. You generate association that isn't there, and we call that collider bias. It's actually a controlling for collider bias. And in epidemiology, you know that there is selection bias, information bias, and confounding bias, and that is the selection bias in epidemiology, same words. So look at this slide. The only time when we have to control for something is when we have an open backdoor path, right? That's this situation here. Don't control for the front door path. So I remove these situations where you shouldn't control, and I come up with a new definition of confounding. You know the definitions of confounding, independent risk factor on Y that is associated with A. That was a historical accident having that definition. The real definition we use today in epidemiology is confounding. I don't even have to play a confounder. Confounding is a configuration with an open backdoor path. That's the informal definition. And that's what you could use in any statistical analysis when you have to draw on your DAG. It can be a more complex picture. Maybe the backdoor path goes through 6, 7 variables, and your task is to control for any variable on that path. Doesn't matter which one, to just block and reach the situation that we have seen here, that no probability flows anymore. So that was basically the brief thing I wanted to show you. I have some exercises now, but I leave them to your homework, basically to do them. But that's the task, the first task we can do with a DAG. It's not just visualizing things informally. Directed acyclic graphs are something that we call homomorphism in mathematics. It's a tool, it's another world. You can basically transform your problem into the pictures, then you solve the problem with the pictures, and then you can bring it back to probability language. So DAGs are a set of tools which rule with rules, and this is what we will use when we want to control for variables and have to find out for which ones to control. So basically you have the question, can I solve the problem? And if yes, do I have variables that I have to condition on, to control for, and put in the multivariate analysis or stratify on? And which are these variables? And actually one of the next steps is which statistical methods do I have to use? So this is the first example, and maybe some of you may want to drop in the answer. Can I solve the problem here? So basically, is there an open backdoor path? And if yes, can I control for the variable? L means the variable is measured. U means it's an unmeasured variable. We all would agree that U is a confounder, right? U is influencing Y and U is influencing indirectly A. The question is, do I need this variable to solve my problem? So what would you think? Answer 1, 2, or 3. Just put it in the chat. What's the right answer here? 3. You're all right. So first of all, there is, how many paths do we have? That's what the computer does. A computer can solve that problem. So the computer says there is one path, but that's a forward path. I'm not interested. There is one path that's a backdoor interested, and that is open. Okay, yeah, I have a problem. And there's another path going from here to here to here. That's all a backdoor path. I have to control for it. Controlling for L blocks basically both of these backdoor paths. So that's correct. I give you more examples, and you can look at them. This one is tricky. This is a collider. What would you say? What would you have to do with L? You must know the answer already. You must know this answer in a millisecond, and I'll tell you why. Some people say you cannot get the causal. That was the first answer. Other people are still thinking. You see, you are still thinking. I tell you something. We have talked that the only problem is an open backdoor path. Look here. You only have to look into the garden of A. You see that? You see my A? You see my garden? You don't have to look at all the other things. You only look here. And do you see a backdoor path? No. These are only things going out. You don't have confounding. You don't have an open backdoor path because there are no backdoor paths. You can answer that question in a millisecond. You look at A, nothing goes in, done. I can do a crude analysis here. I don't have to control for anything. I don't have confounding. I don't have open backdoor path. So that's the beauty of the DAGs. Big homework. This question was asked to 10 professors in epidemiology. 7 got it wrong, 1999. So this was when the first paper of DAG came out. So I leave that for your homework. I'm gonna come to an example now. So if people are interested in more methodological parts, then you will find something here, what we call, this case we call confounding, like initial tumor state at baseline is influencing my treatment and my outcome. We call that time independent or baseline confounding, and usually we use traditional methods like stratification and regression. But we can have something, and this is the problem, we can have something where the ongoing severity of disease, starts with the treatment and people getting less severe, and then you may stop taking the pills, especially if that is pain or some other things. So you may have such confounder treatment feedback loops. This is not a DAG because there is a loop, so I could make a DAG out of this, but this is not yet a DAG. But this is a causal diagram showing me that I have a different situation. Is that a confounder? Yes, because it's a causal fork. There is an open backdoor path, but it's also an intermediate step. And in the old definition of confounding, you cannot call an intermediate step a confounder. But in reality, we have variables that are both. And therefore, the old definition was an accident. You should allow somebody being a confounder and an intermediate step at the same time. But you cannot use regression here because you would have to include that variable in your regression because it's a confounder. And at the same time, you are not allowed to include it because you would have, controlling from the intermediate step bias. So you need other methods, and they are called G methods, invented by Jamie Robbins, 1987, and understood finally in this millennium. So don't take regression to analyze such a data set. So this is where we were, and I talked a little bit about these G methods. So the causal diagram, when you see that loops and time-dependent confounding, you know already something that you have to use G methods. I'm not going to talk about the G methods, but you know already when you have a loop, that's where you have to go. And thanks to Jamie Robbins, he was a bit younger at that time. He solved that, Gaussian knot controlling for variables that are both confounders and intermediate steps. I have a backup slide here for the principles of the 3G methods. I had the honor to be the first person applying the G formula. because Jamie Robbins said, yeah, I developed a method, but I'm not interested in touching dirty data, and I don't have a computer, so Uwe, do you want to do the first analysis? That was my doctoral thesis. So I'm going now to an example, which is the example of HIV treatment. And I'm gonna probably stop there and then leave time for questions. This was an example where people found out in a few randomized controlled trials in the old days, before we had the cocktails for HIV treatment, before we had the hard therapy, but the old antiretroviral therapy. And you find this example also in the literature. And there was a huge registry, which was called the MAX cohort registry. So that was a huge registry and a cohort study where you could see some people were treated, some people were not treated in the early days in the same way. And the question was, is the drug dose, if you increase the drug dose, does that improve mortality or is it harmful? And there were several trials showing if you increase the drug dose, high drug dose has a relative risk of 0.5 to 0.7, so big benefit. But before, and then there was actually a meta-analysis showing around, 0.5, 0.6. But then people said, before we go and put that into the mass in all these HIV patients, we want to do observational study with a real-world max cohort study. And they did the following. They did a crude analysis, and a crude analysis, a crude analysis is biased. So they found out that if you don't adjust for the severity of disease expressed as the immune status, CD4 count here, the relative risk is 3.6. And we know that. We call that confounding by indication. So, the bad people get the high drug dose. The high drug dose may help or not. But what we see here is not a causal effect, it's an association. If I learn about high drug dose, I know, oh, poor patient, got the high drug dose because of a reason, high severity of disease, maybe close to AIDS, nearly dying, probably will die earlier. So the 3.6 is a true number. It tells you that there is early death in that person, but that's not the causal effect of the treatment. Then they adjust it for CD4, but CD4 is a confounder and an intermediate step at the same time. So they got that wrong as well. And they said, we're lost here. We had all these trials showing a relative risk of 0.5, 0.7, and now we kill people here. And they went to Jamie Robbins and said, you know what, probably what goes wrong here. And said, oh, that's all consistent with the trials. You just did 2 non-causal analyses and they go into the right direction. But what's the causal effect? And if you look here, this is what happens. So this is now this is no DAG. This is a sorry, I have to go back. This is a causal diagram which has a loop. So CD4 is a confounder and an intermediate step at the same time. And here we have the severity of disease. Now, when you do the crude analysis, what you get is, well, first, what do we need? We want to get this effect, the direct effect of dose and death, but also the effect that dose improves the immune system and then reduces death. We want to have the sum of these 2 green front door paths. That's my causal effect. We don't want to have the backdoor stuff because you cannot influence anything through the past. So that's what we need. What you get in a crude analysis is actually, is actually the sum of 4 paths. You get the 2 green ones, and you get this backdoor path, and you also get that backdoor path. So the statistical association you get is the sum of 4 paths, 2 you want and 2 you don't want. So we have to control for the CD4 in order to get rid of these open backdoor paths. But what now just happens is that CD4 is also a collider on that path. 2 arrowheads collide here. So you just associate dose and severity on that path, which was blocked before, and now you have a controlling for a collider bias, which goes this way. So both of these analyses are wrong, and you cannot solve that with regression because you have to include CD4 or not. So you need something else, which is not biased, which is called G methods, which I don't teach today. And that basically is a miracle method that removes only this arrow, but not that, because it doesn't work with conditioning on a collider, but it works with inverse probability weighting methods, variant of propensity score, but a different one. Propensity score wouldn't work. And then you get the right result. You just get the 2 green paths. So then they did this analysis. Jamie Robin used his own methods, and this was the result. This result that these people contacted Jamie Robbins helped many, many HIV patients survive until we had the next generation treatment and saved their lives. So that's the problem with real-world evidence. You have to know all this stuff. So this is it from my side here. I jump to a summary slide, which I don't read to you because you still will memorize. And if you want to hear more about causal inference, we have in our HDADS program, we have a 5-day causal inference course. And you find some of this information on the program also here on our website. And there's a video explaining the course. And hopefully I see some of you at the Berlin Medical Decision-Making meeting, which we will host this year. And we hope to see also some, some of the, how do we feed our models with parameters? Are they causal or not? If you have any questions, you still can drop me an email and find me here on Twitter or LinkedIn. I think feeding causal models or doing causal analysis is not trivial, but it's real fun. It's one of the most beautiful things I've seen when I was a researcher. So should I unshare the slides that people see my face a little bit bigger, or should I keep the slide if there are questions?
However you want. Thanks so much, Uwe. There are questions already, and thanks so much, Romina. And I think, Uwe, if you want to read it, I will read it, but you can click in the Q&A button as well. Yeah. So thanks so much, Romina, for the first question. So when you draw your DAG, how do you account for how confident you are on the variables really being confounders, intermediate, etc.? How strong do the associations need to be for a variable to make it into a DAG? What criteria do you use prioritize for determining that those relationships are credible? So that's three questions in one.
Thank you. So this is the typical question. The answer is you have to come up with your expert estimates with your prior knowledge. You don't know all these things in the beginning. How do you know? We don't. So in the worst case, when you know nothing, what you will do, you should draw an arrow from every variable to every variable. But then you would say, no, I mean, I cannot influence my age. Come on. So age can only have a forward arrow, but not coming something in. And then you have repeated measurements, and you can say, okay, the measurement tomorrow cannot influence the one today. So that's how you remove the arrows. But it could be, and in my doctoral thesis, Jamie Robbins told me, Uwe, leave all the arrows in because we really don't know. This is not regression analysis for, throwing out non-statistical variables, but you want to keep all the degrees of freedom. But if you have strong knowledge that something is not happening, then you can remove it. You simplify nature on the risk of making a wrong assumption. So that doesn't satisfy us, but that's the reality. And you don't have to think so much how big an association must be or not be in order to be removed. If you don't know, maybe there's a small one, keep the arrow in. And especially when you have time varying data, then the computer afterwards will tell you how big that effect is. You still can then remove a tiny effect, but maybe you don't have to. What happens if you have an arrow with a small effect and you keep it in your model? Your confidence intervals get a bit wider because there is more uncertainty allowed. If you remove an arrow, you force nature that the strength of this arrow is 0. That's a lot of certainty. If you put that certainty in your DAG by removing an arrow, your confidence intervals get smaller because you put in the certainty. But don't think the data told you. You told the confidence interval to get smaller. That's a very important causal reflection. And those response relationship, you don't. So DAGs are non-parametric models. You don't need to make any assumptions in the first place about is that a linear effect or a quadratic or some interactions? Basically, just tell you what could influence. And then when you do the statistical analysis, the G methods or the regressions, that's where you, like in the typical research you do, you try, machine learning methods, or you try quadratic terms or different subgroups, dummy variables. That's not different from anything you do anyway with traditional regression analysis.
Thanks
and I saw one answer. So somebody solved the homework, yet the difficult one. It's the M bias. Yes, that's the M bias. But try to do that yourself, everybody.
We got a second question from Prakash, and it's already talking about a time varying exposure. So what will be methods to account for time varying exposure? For example, if we want to assess whether patients assessed during the pandemic had high anxiety compared to those assessed before the pandemic. Each patient assessed at different time during the pandemic and thus had different time spent in the pandemic versus time not spent during the pandemic. Simply examining assessed during pandemic versus before pandemic would ignore time varying exposure, as some are never exposed, some are exposed for a few days, and some are exposed for more days.
Yes, that's actually the question that leads into the more complex field, what you have to do. So this is the situation. When I show you a DAG, something is changing over time. So here we have treatment A that influence. So first of all, there's a confounder indicating, you got your infection or your treatment, or you wear the masks, but that at the end then may influence, the confounder itself. Then you have this loop. The loop basically means that you don't have just one variable, and you're completely right. You need to disentangle that. You say A now, L tomorrow, A after tomorrow, L after tomorrow, and so on. So this is what you do. You draw the time varying DAG, and then the DAG looks like this. This is not a DAG, you have a loop. When you disentangle the loop over time, the loops go away. So always L influences A is always influenced by L influences Y. You find that all in this DAG, but now we have time points. So first, you need repeated measurements, otherwise you cannot solve the problem. Second, then in this world, you cannot solve the problem anymore with regression analysis. Because if I would control for this variable, that would be nice, being a confounder for A1, but it's an intermediate step for A2. So I cannot control for this variable. If I control for this variable, what happens is that I get L is a collider on that path, and I go back and I have a collider bias flowing. So this is where I said you use G methods, and the 3 G methods are G formula, G estimation, and inverse probability weighting. So these are the methods. You cannot use regression here. So the answer is you need time repeated measurement data in that situation, and you need G methods to solve that. And G methods you may be mastering or not, but then you would have to talk to a statistician. Can you do G methods? If not, you come to me and we do it.
All right. Are there any more questions? I'm not seeing any typed in yet. But there are no open questions.
If there are no questions and people are interested in using DAGs for pragmatic trial, there's a nice paper for protocol analysis in pragmatic trials. If you want to control for post-randomization confounding, to get a per protocol, a valid, not a naive, but a valid per protocol, a cost per protocol effect, then that paper shows you 4 different situations with no confounding, simple confounding, where you do nothing. The simple confounding, you use regression analysis, and with time-dependent confounding, you use some of the G method. And you can even have the situation with unmeasured confounding. And there is a miracle. If you have a randomized trial, you can deal with unmeasured confounding when you use G estimation. There is one method that doesn't need to make the assumption of unmeasured confounding, but only if you have a randomization variable in a pragmatic trial. If you have purely observational study, then you always have to make the assumption of no unmeasured confounding. I show you one last slide, which I like a lot. This is just ignore all these terms here. These are different methods, many different methods my doctoral fellow Feli Kühne has used to analyze observational data set with more than 4,000 American women for ovarian cancer screening. We knew the truth because there was a trial. The dotted line is the truth. It's basically a null effect. That the treatment kills as many people as it lets them survive. All these analyses that we are usually do are heavily biased, 0.5, 1.5, but just the last one, using all the causal methods, gets close to the trial. So it shows you can do all the stuff you do as usual, and it's totally wrong. It's a little bit like the example of HIV. You can do all this analysis, adjust for it in the wrong way, but you don't get the truth unless you try and use method. Now, when I do a decision model or a cost effectiveness model, I want to have these estimate. That's what I would like to plug in. All the rest can give you miracles, harms and benefits and dominated situations, but they're just simply wrong. So my message as a decision scientist, a modeler, is if I take something from a regression paper, a coefficient, a hazard ratio or something, first I draw the DAG, and then I look what I would have done, and then I ask whether the people have done the right analysis, and if not, yeah, I have to stop. I cannot just plug in that number.
Thanks so much, Uwe. That was excellent advice. That would be my question, like kind of how do we expand it, the connection to decision analysis and modeling, because I do see a couple of trainees in that field on the call. So thank you so much. And I also see many other trainees and faculty, people in epidemiology and decision analysis and health services research on the call. So anyway, thank you so much for being here today. For everyone who have asked, we will share the slides because they're amazing, and I think it's a great reference. You had a lot of really amazing figures in there, Uwe, so thanks so much. I think it'll be a great reference for everyone. And otherwise, thanks so much everyone for attending on a finally sunny day. We've had a week-long rain, Uwe, and so finally the sun is out, and it's so great to see so many people. We are back in 2 weeks from now, talking about the new guidelines for economic evaluations of vaccines in Canada. So thanks so much and have a great afternoon and weekend, everyone.
And we see thank yous coming.
Thank you all. And if you have data,
Yeah.
if you have data, feel free to, contact me, and I work for free if it's on causal inference and you have some good data.
Oh, that's good to know.
We always have data. Okay.
Thank you.
And
Bye.
have a great evening, Uwe. I know it's late for you now. So
Thanks so much.
Fine.
Thank
I hope
you.
you enjoy. Yeah.
That's my highlight.
Thank you.
Thank you.